was a philosopher that said, "Let thy food be thy medicine." And for our babies, it truly is. These children who come to us in the nursery, if you think about it, they are about the size of a beanie baby bear, and they weigh about as much as 2 cups of water. They've not yet had the chance to put on their bone minerals, the protein for their muscles. Their skin is very thin. They are building everything that they would have built if they had had the chance to stay where they belonged as long as they were supposed to. We have to provide it to them in a way that is safe, that they can tolerate, and that gets them to be that healthy, happy baby that gets to go home.
I kind of think of a milk room as the nutrition pharmacy for children in the children's hospital, both in the NICU and in the regular parts of the hospital. Nutrition has become such a complex and intricate process.
Nutrition is probably one of the most critical elements because these babies are constantly growing. They have very fast metabolism, and it is an integral part of their treatment plan.
The current way that the food is prepared in the patient's individual space to help with cohorting their food and their needs together, and then the nurse prepares it every assessment.
There's about 50 to 60 babies just in the NICU, and they all get fed 8 times a day. So those nurses are spending a lot of time at the bedside making these feedings, and it's time that they could be using to do essential patient care and teaching of the families.
In our older children, the children who are based off of formula type feeding, that is prepared in a small area currently in our kitchen. They have the recipe to prepare, and then they will go ahead and mix it and deliver a 24-hour supply to the floor. With the milk room, we will have trained, certified workers. We will have very specific storage places. We will have a system that will interact with our current computer system. It will let us keep inventory. It has the opportunity to contact mom by text or email to say, "We're starting to run a little bit low on our store here. Do you have more that you can bring us?" And that way, the baby continues to get mom's milk.
The ability to come to the bedside and just focus on the babies is so important, and I think will really improve patient care, family satisfaction, everything that we do for our babies in the unit.
We need to maximize our care that we give the babies here, and this would be one of those ways to just be providing more quality care, and it would be impossible to do without our donors.
As they become more and more complex, as we're bringing kids into our unit that are younger, smaller, have more congenital problems, their nutritional needs are changing. These complex babies are not only complex on a nutritional basis, but their care is very intense, and being able to return that bedside care to the nurses and taking away the time that they were doing to prepare their food is going to really improve the patient care that we provide for our sickest, smallest children.